Hello, I'm one of the CP2 medical students, currently on the special study module for laparoscopic and robotic surgery. My presentation today is on the use of morcellators and retrieval bags in laparoscopic surgery, with a particular focus on gynecological procedures. This presentation will cover the definitions of morcellators, what they do, their history, the different types that are available in the market, the advantages and disadvantages of using morcellators, and we'll also look at retrieval bags and the different types that are available, the different techniques that are being used whilst using retrieval bags, and the evidence that has been found surrounding morcellation that has been done with retrieval bags or without it. And we'll end the presentation by having a look at the different costs for different retrieval bags that are available at the moment. Morcellators are essentially just surgical instruments that have been used for a long time in laparoscopic surgery, and they're used to cut bigger pieces of tissue into smaller ones. They were initially intended to be used only for gynecological procedures, but have since then been adapted to be used in other types of surgeries, including gallbladder, spleen, and liver surgeries. They were designed or developed to decrease the size of an enlarged uterus. It was so that the surgeons did not actually have to operate openly, and so that they could deliver the uterus through a woman's vaginal canal, or they could remove it through these small incisions that are made whilst doing laparoscopic surgery. They've helped decrease the number of patients that have had to undergo open surgeries, and which are known to be more invasive, usually have a higher risk of blood loss, and potential complications they have a higher risk for those as well. A little bit about the history of morcellators. The first one was approved in 1991 by the FDA, and the first one that was actually placed on the market to be used in surgeries was placed in 1995. The interesting thing about this is that it was placed on the market without extensive clinical trials through a 501(k) route. The first ever morcellator was on the market was the Cook tissue morcellator, after which Karl Storz and Johnson & Johnson released their version as well. I believe Karl Storz's version is the one that we use in Derby. In 2014 then, the FDA released a warning saying that around 1 in 300 up to 50 cases of women who undergo paramorcellations for hysterectomies or myomectomies might have an undiagnosed uterine cancer. In 2017, then the FDA reaffirmed their warning, but they did not put a ban on it. They have recommended that morcellators, should they need to be used, should be done on appropriate cases only, and they should ideally be done using containment systems or retrieval bags. The warning on the FDA came about because they found that normally a uterine sarcoma and uterine fibroids are difficult to distinguish before surgery because the signs and symptoms for those are quite similar. But when paramorcellations have been used for myomectomies or hysterectomies in women who've been presumed to just have uterine fibroids, it's been found or theorized that the morcellation process might actually pose a threat to spreading of the cancer beyond the uterus, and that would obviously decrease the patient's long-term survival chances, increase complications. It was found that approximately 1 in around 225 to about 1 in 580 different patients who had undergone surgery for uterine fibroids might have had a hidden uterine sarcoma. Leiomyosarcomas were also present in approximately 1 in 495 to around 1 in 1100 patients that had undergone surgeries just for uterine fibroids. Since then, there have been several studies that found that patients who have had fibroid surgeries with laparoscopic paramorcellations have been then later found to have a hidden uterine sarcoma. And it's been believed that morcellation might have helped the process of spreading the cancer, or turning precancerous cells into cancerous cells. FDA have then ever since then recommended that morcellators should not really be used in gynecological surgeries to treat patients with suspected or confirmed cancers, and in women over the age of 50 who are having a myomectomy or hysterectomy for uterine fibroids. However, they have also said that if it needs to be done in appropriate cases, it should be done using retrieval bags or containment systems instead. There is new emerging data, however, that suggests otherwise. There was a study that was done that had 41,777 women who had undergone myomectomies at over 400 different hospitals, and they had had electric paramucilation, and it showed that the prevalence of cancers and precancerous abnormalities of the uterus in patients who had undergone myomectomies with or without the electric paramucilation, the prevalence was actually very low overall in general, but it does increase with age, which is why it's recommended that women over the age of 50 should be, if they do need to undergo paramucilation, it should be done with retrieval bags. There are different types of mucellators that are available at the moment on the market. They've also been designed specifically for different types of surgeries now. The list on the slide here is from Karl Storz. This is the one. These are the mucellators or the types of mucellators that are available at the moment from them. Because this particular presentation is done with a focus on gynecological procedures, the one that I want to talk about is the RotoCut G2. It's one of the later versions of mucellators that they have developed, and it's been designed to improve efficiency and save even more time than the previous models. It has a hollow shaft motor, and it basically provides optimal function, and it allows initial abdominal access without the motor. It also has a peeling function for rapid mucilation, which has been found to be quite useful in gynecological surgeries, and it also helps with reducing the amount of time taken during the operation. So regardless of the type or the manufacturer that has made mucellators, the function is pretty much the same. They do use a blade and suction tube, and it helps them cut and remove tissue simultaneously, which is quite helpful in surgeries because it improves visibility and it also reduces the risk of perforation. It also decreases the time that is spent in operation, and they're also very easy to use, and they do come in different sizes. However, they don't cauterize blood vessels, and studies have shown that they have a very limited role in type 2 myomas. Their cost does vary, and depending on the availability and the model and the type of surgery that's being used for, so it can be expensive. And they do have an FDA warning against them, and they have been theorized to at least help with the spread of cancer in some types of cancers at least. So as FDA did release a statement, a warning statement, and they did state that if mucilation is to be done, that they should be done in containment systems or retrieval bags. We'll have a look at those next. Retrieval bags have been around for a very, very long time. They've been used in gynecological surgeries to remove masses and cysts through small laparoscopic incisions. They've helped avoid spillage into the abdominal cavity, and they've been used to decrease the risk of spreading cancers. This is essentially what a retrieval bag looks like. There are different types of them, which we'll discuss later. But essentially, this is what an average one looks like. It's got a rigid plastic shaft, and it's there to provide stability. The pouch is usually transparent, and it's usually made to endure heavy masses of cysts. And the transparent material also helps surgeons see the tissues on the pouch clearly and ensure that all of the tissue has been placed inside. There's firm joints on the pouch edge, and they help to prevent breakage when the pouch is being pulled out of the abdominal cavity, as is quite commonly done in laparoscopic surgeries. The memory metal ring at the top, that varies between different types. But in some of them, it actually helps open up the pouch automatically as soon as it is inserted into the abdominal cavity. So retrieval bags come in all different shapes and sizes, and they do vary in diameter, and the techniques that are used to open them or to deploy the bag do vary as well. The most commonly used specimen bags in gynecology then range from about 10 to 15 centimeters in diameter, and they're commonly they allow easy removal of most adnexal masses. The diameter is basically where they vary the most, so that's the most significant difference between these. A 10 centimeter bag requires a 10 centimeter diameter bag then requires a 10 millimeter laparoscopic port for introduction into the abdomen, which can be done through the umbilicus or through lower abdomen. The umbilical port is somehow, studies have shown that it actually it's easier because it doesn't actually require the closure of the fasciole there as well. The specimens that have slightly bigger diameters do require bigger ports, and they might require, in some cases, to close the fascial layer to avoid post-site herniation or the complications. However, the closure of fascial layers might be required in any particular type of surgery, regardless of the diameter. So the most commonly used retrieval bag in the market at the moment is known as an endo bag, and it's a specimen container. It's sterile and it's got a dispensing tube, and it's very easy to use. They come in different sizes. It comes in 10, 11 or 12 millimeter cannula as well. And within endo bags, there are 3 different models that are quite readily available. There's one that is without the pull wire. And in this one, there's a memory metal ring, which cannot be separated from the pouch at all. So the memory metal ring is at the top of the pouch, and that cannot be separated from the pouch at all. It's quite a popular style in Asia. The next one is the one with the pull wire. So the memory metal ring in this one can actually be pulled away. So that's basically the only difference between those two. The last one then is the one that has no grip, and it's to allow the pouch to be pulled out of the shaft entirely. It's very easy to use and replace latex gloves retrieval bags, which is what was done at a previous model. So different retrieval bags then come in. They have different colors on the shaft. It's to basically indicate how much volume the particular pouch that is attached to this particular shaft will be able to carry, and it's to allow surgeons to make a judgment before they use them, so that the pouch doesn't rip, or that it's easy when it's being pulled out and there's no spillage, or chance of contamination are lowered, or that they decrease significantly at least. Other types of retrieval bags that are available on the market include EndoCatch and ReliaCatch. They all essentially do the exact same thing, but the EndoCatch has got a long cylindrical tube, and it's got a polyurethane pouch, and it minimizes spillage. That's the benefit of using this particular one. The ReliaCatch, on the other hand, is a newer model, and it again has a long cylindrical tube, but it has a ripstop nylon, which actually ensures and encapsulates and ensures that the specimen does not leak, or nor does it nor will it rip. So the retrieval bags that I've spoken about so far are the ones that are manufactured, but retrieval bags have actually been around for a long time, as mentioned previously, and many surgeons have actually made their own version of it, and they've been used in surgeries as well. They're known as homemade retrieval bags. There's a particular study that looked at their use compared to ones that have been used by compared to the ones that are made by manufacturers, and it was found that there was not much of a difference between how well they were endured. So this particular study that was done in 2012, the used a retrieval bag that was produced mainly from a large surgical glove, and they introduced this particular bag via a 12 millimeter port, and 135 of the patients who had undergone various laparoscopic procedures had been done with this homemade retrieval bag, and it was found that there were no complications during or post surgery. The risk of spillage was exactly the same as it would have been had they been using a manufactured version, and they found that all procedures were performed safely and no bags were broken. The benefit of using a homemade retrieval bag is the cost, though. It significantly is cheaper, and we will compare it at the end. So, as mentioned earlier, that retrieval bags, they do come in different sizes and shapes, but they also have different techniques that are employed by them. So the specimen retrieval bags, they differ in how they're opened. Some bags open automatically as soon as they're introduced into the abdomen, whilst others require a manual opening, and that is done by having two graspers which hold the bag edges. The ones that have automatic openings are easier to work with, but are slightly more expensive than the ones that are manual. But most studies have shown that if you use a 10 centimeter diameter retrieval bag that requires a manual opening, that it works really well for most adnexal masses surgeries. So mucilation, then it can be done within a retrieval bag as well. And how it works is that a large specimen bag is placed into the abdomen. And this is a large specimen retrieval bag, and the edges are exteriorized into the abdominal wall, if possible, and then the specimen is just placed inside the bag, and the mucilation takes place using either a single port, or they can use multi-port approaches as well. So the large size of the particular tissue is basically made into smaller chunks inside a retrieval bag, and then it can be pulled out very easily. And the idea behind it is that the chances of cancer spread, which have been theorized, will be lowered. There is, however, very limited clinical data available on the outcomes of doing this or on the safety of mucilation with retrieval bags at the moment. So retrieval bags have been around for a long time, as mentioned previously, but they have also been, lots of the times retrieval bags have been used without mucilation. Even before the FDA warning. This particular study was done in 2011, where they found that 42 patients who had undergone laparoscopic tissue retrieval, 34 of these had actually had a very successful tissue retrieval, and in 8 of these patients it was unsuccessful because the mass that was within the retrieval bag was too big. And it meant that when they were pulling it out, the umbilical incision through which the retrieval bag was inserted actually became larger. But no sac rupture had occurred. There was no intraoperative complications that were related to the tissue retrieval, and they didn't find any incisional hernias had occurred 2 to 6 weeks post the operation either. And only 3 of these patients had had a wound infection, but that was managed conservatively. So the use of retrieval bags with mucilation, which is ideally what is recommended by the FDA at the moment, in higher risk cases at least. So that's been done for a long time as well. In 2008, this particular study was done that involved over 1,000 women who had undergone operative laparoscopy tissue retrieval, and they basically had brought the mouth of the sac out of the port with the help of a traumatic grasper, and the specimen was then mucilated to avoid the intra-abdominal spillage. And it was found that no intraoperative or immediate post-operative complications related to technique of specimen extraction was found. Also, no site herniation was found, and they didn't find any metastasis either. There have yet to be studies that look at retrieval bags with mucilation versus mucilation on its own. And there's yet comparison to be made whether that this actually does decrease the chances of cancer spread or not, but it's just it's presumed to be safer technique at the moment. Last but not least, the cost of retrieval bags then. So it does vary, and it varies significantly depending on the type of retrieval bag that is used, and also which company is making them, and the availability, and personal preference comes down to it too. The most expensive bag that is available on the market at the moment is the Endo Catch bag. And the one that's most commonly used is Endo Pouch though, and that is around $35 a piece. However, people who've made retrieval bags at home, or the homemade versions of them, they cost less than $1 per piece. So the cost is significantly cheaper. That brings us to the end. Thank you for listening.